Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back, and we're moving into our first conversation for today. While we have been not necessarily diving into this issue for a while, because we've just been hoping that the cases go down, they are. Yes. But it's a great time to remind ourselves that we're not there yet. It's not over. And so with us, we have two doctors. We have Dr. Jorge Hidalgo, who is an internist with Belize Healthcare Partners, and Dr. Shanna Pott, who is a general physician at Belize Healthcare Partners. Good morning, and welcome.
Good morning.
Thank you.
Good morning. Thank you.
Yes. So I know the conversation I've been having over the past week has all been the same. Everyone says, we're done. We don't want to do this anymore. And with the reports of the numbers going down, it makes us feel like we're nearing the end of this.
Yeah.
I see your facial reactions. Let me just, I'm sure you've heard the same sentiment. What do you say to people about where we are now in the pandemic?
Well, thank you for having me and having us again. And I think so that is a very important question. And as you can see, each country behaves in a different pattern. No? Mm-hmm. And then, of course, one of the things we will love and we will probably say, okay, that's good that we are over from the pandemic, and unfortunately it's not the case. Mm-hmm. And one of the things we are definitely put an eye on it is the trend and mm-hmm. how this Omicron pattern is being, as started in November. Mm-hmm. And then, as you can probably know already, we have, and we've been discussing this over and over, that virus by nature are going to change. Yeah. Meaning that Omicron is one variant, but is the last one? No, mm-hmm. definitely no. And because Omicron, one of the things that it called our attention since the beginning is his ability or the transmissibility of the Omicron. Mm-hmm. And not only that, but as probably you know already, we have 4 subvariants of Omicron. Yep. And of course, 3 of them probably we are not putting too much attention, but the BA.1.2 is one of the, it's been on the look.
Why? What's unique about that variant?
Because it's more transmissible. Mm-hmm. It makes people, of course, one of the things with Omicron at the beginning is that it can present with a variety of symptoms. Mm-hmm. And now, as globally speaking, the number of deaths has been increasing in the last weeks. No? And then again, the patterns country by country varies, mm-hmm. And us we are in decline. Mm-hmm. But as we know already, basically when we are climbing and then coming down from a mountain, it could be really bumpy. Yeah. Mm-hmm. You know, we are really declining. We hope that is going to be the case. Yeah. But is where we need to be more alert.
Yeah, I totally agree. Go ahead. Yeah.
You know, and when we say things like that we're in a decline, then people become very relaxed, and mm-hmm. that's when we have to be exactly. We have to be careful because we had that peak right after Christmas and New Year's. Mm-hmm. We had, you know, like everybody that was coming in sick, and we weren't even picking up all the cases, I'm sure, weren't being reported. So it's when we're in that decline that people tend to relax. You know, tourism is boosting again, mm-hmm. and everybody wants to be out there living their life. And mm-hmm. It's also necessary because when you're talking about people like the day workers, mm-hmm. you know, and so it's just that even though we're seeing a decline, we still have to maintain the protocols and be careful, you know, wearing your mask and maintaining the social distancing. And these are the things that we've been saying from the very beginning. Yeah. So, and like Dr. Hidalgo mentioned, that's very important, is the variants. Mm-hmm. Because the more that this virus is transmitting from one person to the next, that's giving it the potential to mutate.
Yeah.
So how do
And
you
so-
how do you respond to the comments of, well, you know, it's decreasing, let's get our lives over with, get rid of curfew, curfew doesn't make sense anymore. How would you address these comments?
Yeah, well, it's the same thing that I'm saying, that, you know, it's when we have to maintain being alert to these things. So I don't think that we're there yet.
Okay.
I mean that one of the other things is, as probably we hear a lot, is that all COVID is basically a common cold, and but it's not the case. I mean that the Omicron definitely at all is basically give a variety of symptoms, and most of the cases are mild. But as mentioned, especially globally, the amount of deaths have been increasing.
Increasing.
And as you can see, there are no one model that fits all countries. I mean that each country needs to adapt and basically do what is basically best for in the best interest of everyone. No? But
Yeah.
and also based on the resources that we have.
Yeah.
I mean that one of the things is that, and we see in a lot, we have patients that probably they go with completely asymptomatic, and they are scheduled for a routine procedure. And then of course, us as a hospital, we as a routine, before we admit a patient, we do
Screening.
testing and screening, no? And they became positive, and they say, but I don't have any symptoms.
Yeah.
And they just basically go, as I say, for a regular
That's the only reason they
procedure.
detect it.
Exactly,
Yeah.
right.
But then you have to be conscious. These people also have to be conscious, because then they're more likely to spread it.
Yeah.
They don't have any symptoms, so they're, you know, around their families or friends, and for some reason people tend to believe that those they're close to, they're safe around them. So that's
Yeah.
when we let down our guard. You know, you're having meals together and that sort of thing. So, and it's high, there's a high possibility for you to infect somebody that will become severely ill. You know, and we have to be reminded too that we still haven't, our population is still not fully vaccinated. You know, so we still have people who are not vaccinated. We have our children, and children have, I've seen several cases in which children are very symptomatic. You know, my own child had contracted the virus, and I was just telling Dr. Hidalgo that we're still not, although he's tested negative, we're still not fully through it, because he's still complaining of some minor symptoms.
Yeah, yeah. I mean, that's kind of the it's a catch-22 with Omicron.
Yeah.
Because it's so transmissible, and so many people have gotten it, and they've been asymptomatic or mild, that it kind of gives you the impression that, oh, we can all get through it. But we've seen hospitalizations and ICU admissions. That's what I want to ask you. I mean, from the people that you are seeing in the hospitals, or that you know are being treated, I mean, it's not mild for them.
No, actually, at probably beginning of January, and by the end of January, we were busy at our COVID-19 unit at Belize Healthcare Partners. And we have also patients that it required to be ventilated. I mean that again, the Omicron, majority of the cases are mild or asymptomatic, but also there are several people that get very ill. And the other aspects that we need to mention is that most of them have a severe symptoms after all, or that we call it the post-COVID. No, it's something that also we need to probably later on we will talk about. No?
Yeah.
How do you compete with Dr. Google in the sense of, you know, because
That's so true. Yeah.
because a lot of people, you know, January, February, it's flu season, people have allergies and so forth. And so what people will do is they'll Google their symptoms and they'll be like, I don't have COVID, so I'm not going to
Well,
get
Dr.
tested.
Google has always been an issue in healthcare. It's always been an issue. You know, people will come to you and say, I have this because I Googled my
I'm
symptoms.
dying, and so.
So it's not about competing with it. It's just, you know, presenting the facts and trying to educate as much as we can, because that's a part of our responsibility as healthcare professionals, is also to educate the public. That's the best that we can do, and try to present, you know, science against all these things that are on the internet, because a lot of time people believe that whatever they read on the internet is facts.
Yeah.
You know, so I know, like, lately a lot of people have been telling me, oh, I heard that they're going to start addressing COVID like just a flu, because there's been some European leaders. I think the last one was the Prime Minister of Spain, talking about that, you know, they need to drop the regulations and learn to live with COVID like a flu. But the health officials are not on board with that as yet.
Yeah.
You know, because I mean, they're the ones that we're following science
Yeah.
and medicine, and we're seeing what is still happening worldwide with this virus.
Dr. Hidalgo, I know you keep, as a part of your network of specialists, you're always aware of what's happening in other parts of the world, not just the United States, which is all we usually watch on television. Let's talk about what scenarios you're seeing in other countries, Latin America, that perhaps can be a guidance for us here.
Yeah. Well, as I mentioned before, no, unfortunately, there's no a model that fits all the countries.
Yeah.
In that, and one of the things is that actually we're reviewing last week about what should be the model for our country, like to open the land borders, for example. And then we went and we review the trend in Europe, and you see that nobody is basically following the same model. Some countries, like Dr. Shana say, are thinking on lifting all the measures. All countries say, no, we will keep our measures as it is, and probably higher our level of measures. Some others say, okay, we're probably trying to reduce some. I mean that there are not really a standard of what we should do. No? I mean that what essentially we're saying is that we need to trying to see what are the resources that we as a country have, and based on that we need to see what is the best, because we need to take in consideration that if we are going to do this measure, what are going to be the consequences. We are prepared in terms of resources, in terms of a capacity to overcome this number of patients. Other things we also discuss is about vaccination, boosters, and also we've been discussing about the third dosage, and some other countries like being a model in Latin America, like the three we were discussing at the beginning, the three countries that have the best rate of vaccination, like Costa Rica, Panama, and Chile in Latin America. Actually, Chile, they already starting in the high-risk population with the fourth vaccine, fourth dose of the vaccine.
Fourth dose,
Yeah.
wow. And we still don't have very many people boosted. Can I ask, I know there is a push and continuous education on getting people their booster shots, because we've seen where 2 shots was not sufficient to be able to hold up against the existing variants. Do you think that we should perhaps move from the definition of fully vaccinated to include that 3rd shot? Because we have, what, about 30,000 people out of the 200,000 fully vaccinated that only 30,000 have gotten a booster.
Yeah, and we are moving to that direction, as you know, and as it is that you mentioned, because when we see globally speaking, the amount of patients that basically require hospitalization has been more in the group of the unvaccinated people. The majority of deaths, globally speaking, are in the unvaccinated people. And that despite of that we need to agree that with Omicron we see a lesser on efficacy, but still good amount of protection,
Protection.
especially for those that got infected.
Yeah. And when we talk about the possibilities of new variants, I think, you know, it's if we see the trend that we've seen with Omicron, where at least it's not as detrimental to the body as we've seen in previous variants, do you think that will be a positive sign moving forward? Or there's no way of telling?
There's absolutely no way of telling what the next variant will bring, if it's going to be stronger or weaker, you know.
Will it hold up to the vaccine or not?
Exactly. So that's the reason why vaccination is also important, because it's the only way for us to stop the spread, you know, or to lessen the spread.
Yeah.
And the other important aspect, when we always say, you know, if the situation is that if we allow the amount of cases to be increasing, that if we have more cases, if we have more people sick or more people exposed, then the possibility of to have a new variant is definitely there. And definitely we will have a new variant, because it's the nature of a virus to survive.
Right.
And that we hope that probably it's going to be less dangerous than the Omicron and of course Delta. And we hope that the hope of everyone is that we are leading to the trend that this one is going to became endemic as the influenza. No?
Yeah.
And one of the things I want to mention, since you brought it, is that with influenza, no, all the measures we took at the very beginning of the pandemic, since 2020 and the end of 2021, you see that the influenza, basically, we don't see too much influenza cases. Now that, of course, everybody in a way is basically be less precaution, then we start to see a trend on influenza cases again.
Yeah.
Wow.
And it's caught the same way you catch COVID.
Yeah.
Exactly.
Yeah, it's respiratory droplets or, yeah, that's interesting. So even if you have a flu, even if you think you have a flu,
Right.
it could still be COVID, because
So you
it's
still have
getting
to
it the
get
same way.
tested.
Yeah.
But I wanted to make that point on, I think you brought up the asymptomatic patients. How are you guys dealing with contact tracing? Is that working in any way to take preventative measures?
Well, I know that the Ministry of Health follows up with contact tracing, and there's the database where all the testing facility have to upload their data at the end of every day.
Okay.
You know, so I know like some of the polyclinics that are doing testing, they cut off at 2, because then they have to upload that data so that it's available at the end of the day for reporting, for contact tracing, and all that, you know. But as a healthcare professionals out there too, we do our best to educate people once they've tested positive. You know, you need to inform the people around you. So sometimes when the ministry reach out and, well, you tested positive and your household needs, these people already went and got their test and things like that. But it's also important that when people go and get tested, the time that they go and get tested, because the virus has an incubation period.
Yes.
And, you know, so that's how some of the cases have been missed as well, because people may go too early to be tested and they're like, oh, I was negative.
Yeah.
So then they don't go back.
It's interesting though, right? Because it could be symptomatic. Like I could go test today because I feel symptoms, and it could be negative, but I still would have to go back and test, and then it'll be positive.
Yeah, so that is the reason why it's important that you know that you had that contact.
Yeah.
You know that there's a high possibility. And even if you don't know that you had a direct contact, I mean, there has been so many cases and increasing, you never know where you could have picked it up.
Yeah.
So the minute you start with symptoms, you have to do the responsible thing and isolate, get tested. And even if the test is negative, you know, maybe wait a few more days and retest, because it's a responsible thing to do to try to put an end to this.
I often feel like that is the difficulty though, because let's say you were in contact with somebody that tested positive on Friday, or they were positive on Friday and they didn't test till Saturday, and then they told you on Saturday, but you were with them on Friday. So then when when do you test?
Yeah.
You know, that is in itself is also like a bit of confusion, no?
Yeah, with Omicron especially, because Omicron, it changes everything. It reduces the incubation period. I mean, and also that's important to know that with the Delta or the previous variant, we say we are already okay at the 4th of the 7th day,
Yeah.
more or less you will have symptoms, but with Omicron is different. You will the incubation period is less. The moment you are going to become positive could be earlier, but also the other thing is that you are completely asymptomatic. But and that's one of the excuses that many people say, or say, you know what, it's best to get Omicron right now because you are going to get like a flu and you will get over it, and that's it.
Yeah.
But we need to remember that more or less we don't know. It's not an exact science,
Yeah.
but more or less after 90 days, then you'll be at risk to become
Again.
reinfected again.
See, that's the thing that people
Yeah.
don't, well, I think they are a little bit ignorant about, is that you could catch COVID twice.
You can
More
catch
than
COVID
twice.
Or more
and
than twice, you know,
There's
you
the
can take it, you
high
can get it
possibility of
multiple times. It's not like
reinfection.
chickenpox, but then so you catch it once and you're golden, right? So you still have to be careful even after, because you have COVID confidence. That's it's a trend. I catch COVID, I free to be now, and then
Do we know though if because that is interesting. So
Yeah.
the repeated cases of COVID, is it all different variants, and do we know yet whether you can catch Omicron again?
You can catch Omicron again, and because
Confirmed.
Wow.
of course, it's the only way we can say this if we have the possibility to sequence everyone.
That's true.
But unfortunately, this is not the case, no, because of course, even that again, and I want to say it because even that we Belize, we are the luxury that we have our own sequencing in country. We are only the few countries that have that luxury. It's very difficult to sequence everyone. It's as far as expensive, no. But that should be the only way.
Wow. Is there a difference between how COVID affects the body if you have repeated infections?
It's difficult to say.
Okay.
Again, COVID it can present in a variety of ways, especially with Omicron. It's not like, oh, you will have a respiratory symptom. You can have no symptoms, or you can have muscle ache, headache, you just scratch your throat,
Gastrointestinal.
and then you
Back
have
pain. I've heard people
Exactly.
complain about back pain
Yeah,
with
back and
Omicron.
neck pain, the vomiting and diarrhea.
Yeah.
chest
You know,
pains.
so
Yeah.
But you know, one of the things that we have learned, and that's probably the hardest part about this pandemic, is that science is discovering while we are living with the realities. So sometimes what we knew in the beginning, we learn better with time. So what we know now is that COVID is systemic. You've mentioned that a few times. It's not just like a flu. Is Omicron affecting the body the same way as the previous variants did?
Definitely, yes. And then one of the things we say, and also we are learning, is the post-COVID, and I will enter to that conversation now. We have in Belize Healthcare Partners the post-COVID unit. I mean,
Post-COVID unit. Okay, so
That
it
is-
means you've recovered from COVID.
Yeah, being that what we realize is that we see the patients with COVID, but also we have the patient with post-COVID. And we started a couple months ago with the post-COVID unit, and then we have the lung rehabilitation as well.
Wow.
Because we see patients that after COVID, we have patients that they have COVID and after a year they still require oxygen.
Wow.
In those that have the lung affected bad. But also COVID can give you other symptoms after all. You can have tiredness, you can have nightmares, you can have problems to adapt, psychiatric issues.
Yeah.
I mean, that is a variety of symptoms.
But they
Yeah,
that
test
we're seeing.
negative, right? They test negative
Yes,
afterwards.
they are negative,
Yeah.
but again, we are still dealing with post-COVID symptoms.
Yeah, long haul. They
Long,
call it long haul COVID
exactly.
too. I didn't realize that. I read a case of a woman who was suffering with depression as one of her long haul COVID symptoms.
Exactly.
In addition to fatigue and other physical ailments. Do you think that perhaps people in Belize who have had COVID, whether mild or moderate, are perhaps experiencing symptoms of long haul COVID and not know?
A lot. I mean that what we're seeing is that we're seeing more people coming to do the post-COVID evaluation. We do lung measuring capacity testing in the with the respiratory therapy. Also, we do those type of evaluations to see if there's any psychiatric problems. We have psychiatric unit at the hospital. And we see a range, a variety of symptoms of different people having and adapting the post-COVID, and for some people are very difficult. Some of them, they are unable to go back to work.
Wow.
I have patients that we need to send it to do the Social Security, all the board by Social Security after a year, because they were unable to go back to work because of the most important symptoms that basically cause problem and is the lung, because what happened after COVID is that there are a lot of scar tissue. We call it a pulmonary fibrosis, and those basically that causes is problems that they be basically unable to win from oxygen. They still require oxygen. Some of them 24 hours a day, some others just for a period of time. But also a lot of fatigue and a lot of shortness of breath. That's all the more incapacitating problems we are seeing.
And even things like blood pressure, high blood pressure, diabetes, these are things that have an onset after COVID for some people?
For some people, that they basically the trigger point for diabetes is COVID. The trigger point for high blood pressure is COVID. So, that's something that we are seeing. Some say, okay, but I never have problems with glucose. We never have problems with high blood pressure. But during COVID, we start to
Is
see
it because it weakened the immune system and it caused a reaction in the body? Or is it just you probably had underlying symptoms before and then COVID kind of just
you see that the COVID is very interesting one, because as we probably are all this amount of people in the room, and if we are exposed to COVID, probably only myself I'm going to get COVID, and no one is safe. Is getting COVID, no? And say, but and that's the question everybody say, why if I was in the same room with the people, and why only me?
Yeah.
But that's
and you are vaccinated and boosted.
exactly. I mean that the genetic.
I think in
and
the
way.
future, many years from now, when they're able to really do the science, they'll find out that there probably is a genetic component or something that makes, because it is strange how some people are affected and some are unaffected, some contract it and some
And
don't.
it's even strange the symptoms that certain people present as opposed to others, you know, so it's hard to say. One of the important things that I want to mention with the Omicron variant is the increase in hospitalization in our children. We've had quite a few over at Belize Healthcare Partners, and I know that Carl Huschner has also seen a number of pediatric cases that had to be hospitalized who've been severely ill, you know, and of children that I've known, like parents would call me and ask me questions or things like that. They've been severely ill with high-grade fever and gastrointestinal problems. So I find that sometimes we're very relaxed with our children, and especially in the variants before, that wasn't really affecting the children. So you see kids out at the park, they're not wearing their masks and that sort of thing. So I think that it's important to put out a message that we also have to be very careful with our kids. I know they're back in school, and the schools have taken the necessary precautions and they have regulations set in place for them to be safe, but we have to stress that as well, because there has been an increase in the hospitalization of children.
And you know, what are the reasons? Is it like dehydration? Is it just a short recovery and then they're able to go be released?
For the most part, I know the ones that have been at healthcare partner has been more of that the gastrointestinal problems or the high grade fever, more than respiratory problems. But remember that children are more predisposed to become dehydrated quicker.
Yeah.
You know, so that constant vomiting or diarrhea, we have to be very careful with it, because they could get very ill in a short period of time.
And the cases that we're seeing now, this decline, I'm gonna put that in, this decline. With the reopening of schools, we see children getting more infected, quote unquote. Yes? No.
Well, the situation is probably not only that, but also the same the fact that we believe that Omicron is not as aggressive. That what is basically leading to is that we are mixing more. The mixing is increasing. Everybody are basically more relaxed, and that's why it's important that we are talking about that we are in a decline, and that's why I say decline is, as we are coming down in a mountain, is bumpy, meaning that right now is when essentially we need to be basically more take more precautions.
Are we seeing now that these cases might be affecting children? Are we seeing more of the 12 years and up getting vaccinated?
Well, sorry.
I know that there's been campaigns like at the schools, in the villages. The Ministry of Health has done, you know, I must commend them on their vaccination efforts, because they've been out there. So it's available. I cannot tell you what the numbers are in terms of that age being vaccinated, but I know that people are, you know, I think the schools are requiring it as well.
Yeah.
And so, but the campaign is definitely there for it, and the
now they're at
vaccine
the booster phase.
Exactly, exactly. They just announced that as well. So
I know a lot of people are waiting on the younger group to get access to the vaccination as well. We keep on hearing from the Ministry of Health that it is going to be soon. I think they're waiting for some vaccines.
Yeah, basically the ministry is working on that to get the vaccines for the 5 to 12 to be vaccinated, and hopefully we can get this soon.
Yeah, absolutely. Now, let me, you know, I think it's interesting when you talk about, you know, why we feel so cautious in this decline is because it's natural. When there's less of a threat, we're not as cautious. You know, when the cases are high, you don't want to go even to the supermarket. When you start to hear and see numbers go down, you think that you have more freedom and you take more risks. But let's jump forward a bit. Next month, it's going to be officially the start of our third year in the pandemic. We've detected our first case in March 2020. What do you think that will look like?
Well, again, and everybody hope that we didn't have this conversation today.
Yeah.
We want to say that probably we are over the pandemic, but we are not there as yet. We hope that, but we are not there as yet. And all of us want to know that probably with the Omicron, as you see, Omicron came and essentially took over Delta very quickly, and then we definitely, in terms of the epidemiological point of view, need to also to adapt to new views, and we hope that everybody can, or we can reach the 70% people to get vaccinated, but that's definitely is globally is not the case. No? I think so. We as a country we have the luxury to have all these vaccines available, but unfortunately the response has not been the same. No? Hopefully, and we encourage people that when the turn is there, please take advantage of that, get vaccinated. Is one of the layers of protection that is proven that it give you protection. Of course, as we mentioned already, everything have side effects, no? But so far, the vaccine has been proved that are effective. And then, whenever you have your turn, please get your booster or get vaccinated.
I'm glad that you brought that up, because even though we see the cases going up every year, we have the reports. Right now we're in a decline, but like I just said during the break, that's not going to last. And we hear people say, well, if the vaccine will work, why is there still COVID? You know, if the vaccine is a preventative measure, how come people still are dead from COVID? So what is the point that I take it, right? So how do you respond to those kinds of comments?
Well, as I mentioned, we've been discussing, nothing is 100%, but definitely what we've seen globally is that the people that are already vaccinated, they have the response to the COVID is best. If they for some reason definitely got the COVID, it's going to be less. It's going to prevent hospitalization, and if you get hospitalized, it will help you to have a lesser form of the disease.
It offers a layer of protection. There's a layer of protection there. So, like Dr. Hidalgo so rightly stated, none of them has been proven to be 100% effective, and nobody has ever said that. So while you can still contract the virus, at least it's not to that point whereby you're needing to be hospitalized or lessen the possibility of ventilation and that sort of thing. So that is why it's important to get your vaccine.
Yeah, I think even with Omicron, there's been some data that shows how severity reduces with how much, how you're vaccinated. 1 vaccination versus 2 versus 3. And the more protected you are, the less likely you are to have severe COVID. So how do we close off this conversation? I know it feels very doom and gloom, but it is, I guess, an opportunity to just remind people of the threats that exist. Yeah?
Well, the threat is there. You know, people are traveling, we're living our lives. We have to be. We're out there working. Our children are going to school, so we just have to be reminded that we have this dark cloud still hanging there. And we have to be mindful of it, not just, forget it. And so that is why I was trying to bring up the children as well. We take them out. There's like, if you go out into the public, it's rare when you see the younger kids wearing a mask. Yes. So if that's the case, I know it's not the most comfortable thing, then we have to try and protect them and not expose them too much.
I've noticed kids have been, like, they've done their due diligence better than adults. They wear their masks, they have their little sanitizers on their bags, they're taking
the thing is with these younger kids that they, these past years they've grew up in this. That's what they know.
Parents teach them.
It's like they learn to ride a bike, so they learn to wear a mask. They learn that they have to wear a mask. They learn that if they touch anything, they have to sanitize. So they grew this generation.
We have a future of germaphobes.
That is true.
We got to get through the pandemic, and this is the important reminder that cases going down doesn't mean that you let your guard down.
Yeah, the COVID is there. Please be reminded that whatever is basically offer protection to know is wearing a proper fitting mask, wash your hands, keep social distancing, and make sure that if you are in a ventilated places.
Yeah. Perfect. All right. Thank you for coming in and providing this update for us this morning.
Thank you.
Thank you for the
having us.
All right. With that, we're going to go ahead and take a break. When we come back,
we are going to have our Belize Estate and Company Limited will be promoting their new vehicle finance and leasing program. So stick around soon for that.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.